Hey everybody, welcome to Medicare Basics. My name is Micah Henderson with Highland Finance. We believe in education is key to making a wise decision about important subjects, and the more important the subject, the more critical the education is. So thank you for joining us. Let's get started on our virtual workshop. The topic today, Medicare. We're going to be going over the different ways to get it, the different reasons to have it, different costs to you, and learning goals with Medicare today we're going to be going over the basics. The pages that I have is full of detailed information for you analytical folks out there. I'm going to be going over a much higher level overview, going over information that applies to a wider field of people. But at any point in time, if there is a point that I did not go over, I encourage you to push pause, screenshot, take a picture with your phone so you remember to go back to that detail and expand upon it when it's necessary. The learning goals that we're going to be going over here today, we're going to be going over what is Medicare, how to get it, the different combinations of products to achieve your goals. We're going to be going over different components of Medicare. I'm going to be going over different terminology. Sometimes there could be more than one phrase for the same thing, and I want to clarify for that. Medicare, what is it? It's health benefits for citizens or permanent residents who have met a certain work history requirement. If you're 65 plus, or if you're under 65 and you have disability for more than 24 months. Also, ALS and end-stage renal disease is another reason to get Medicare. Over the last couple of years, there has been new Medicare cards that have come out. The old Medicare cards have your Social Security number on it, and in the name of privacy and securing your important information, Medicare cards now have a code on it. So if you have your old card, I need you to call 1-800-MEDICARE and request your new card. Very high-level overview of what Medicare is. A, B, C, D, and E. Part A covers hospitals, B covers physicians, C is another name for Advantage plans, though it's not a common terminology for it. D stands for drugs. You got to make sure that your prescription drugs are covered when you go to the pharmacy and pick them up. And then finally, E is going to cover Medigap or supplements. And your Medicare supplement is a term that you're going to hear much more often than Medigap. This is a very important page. So there are three major ways you can get your Medicare if you don't have an option through an employer that you've retired from. You can have original A and B. A, you don't pay for anymore because you paid all your life through working, through paying taxes. And then Part B that you'll start paying once you start your Medicare. You can add that to a prescription drug plan, call a standalone prescription drug plan, $30 a month. And even if you don't get prescriptions at the moment, you are going to want to get a prescription drug plan. I have seen some plans down to $7 and some change, and that's worth it. So later on down the road, if you do start taking prescriptions, you don't have a penalty to follow you. We'll expand on penalties here in a little bit. The second option is if you add a supplement or Medigap plan to your original Medicare and your Part D. Your supplement's going to run you, call it $200 a month just to go with nice round numbers, and it's going to cover all the costs that original Medicare with the deductibles, co-insurances, what those are going to cost you, and the 20% that Part B does not. That's your second option. Your third option is an Advantage plan. Now, with an Advantage plan, there is a lot of benefits that come along with it. One of the main ones is that it comes with a Part D plan, or there are options that it does not have Part D plans, and those are a good fit for people who have Veterans Administration VA benefits, and they get their prescription drugs from there. Advantage plans most often come at $0 a month, so instead of paying that $30 for a standalone prescription drug plan, you're getting it included, once again for the $0 a month. There are a lot of advantages that you'll hear about, such as vision, dental, hearing. That comes along with Advantage plans. Certain ones have more robust benefits depending on the company and the plan. One huge benefit that Advantage plans have that may sound familiar, it's a term maximum out of pocket. And this is a term that you may be familiar with your health insurance, with your employer, everything that you've had under 65. And that's saying the most that can be asked to come out of your pocket in any given year, worst case scenario, is that maximum out of pocket. It really puts that financial safety net, that ceiling on what is your obligation in any given year. Whereas with original Medicare, that first option, there's 20% of a blank number. And you always want to know, what's the total number that's 20% of. It's really hard to get down to a specific number until that bill shows up in your mailbox. So if you want to know without a shadow of a doubt, the most you're going to have to pay is that maximum out of pocket, an Advantage plan might be the right fit for you. There are Advantage plans for people who have Medicare and Medicaid. Now, keep in mind, Medicare is health benefits, 65 plus or under 65 if you've been on disability for 24 months or longer. And Medicaid has to do with your income. But if both of those scenarios match your situation, there are special plans for that. There are special needs plans for that. And oftentimes when you hear advertisements or commercials talking about very robust vision, dental, hearing benefits, they are talking about those plans with Medicare and Medicaid. They don't mention that until you call in and let you know that you're not qualified for that specific plan, but they might be able to find another one for you. In my experience, these last two plans are not very common at all. Let's get into a little bit further detail when it comes to Medicare A and B. It covers hospitals, nursing homes, hospice, home health services. Part B, your professional physician and non-physician services, durable medical equipment, preventative services, all these fall under Part B. Prescription drug plans, like I mentioned, you can get by itself, a standalone prescription drug plan, or a part of an Advantage plan. One thing I want to stress here is if you're working with somebody and they don't ask you the details about your prescription drugs, they're not doing a thorough job searching what might be the best plan for you. You need to tell them exactly what you take as it appears on the bottle. If you take a name brand, tell them the name brand, but if you take a generic for that name brand, tell them the generic. Tell them the milligrams, the frequency that you take it, once, twice, 3 times a day. No over-the-counter items. That is not recognized by Medicare. They're not going to pay for it. So your one-a-day vitamins, they're not going to be covered. But it is your responsibility to make sure that the person you're working with is asking you the right questions to do the best, most thorough job for you. When it comes to supplements, one important thing is, like I said, it covers most, if not all, of the 20% that Part B doesn't cover, the co-pays, co-insurances, deductibles, but it does not, you cannot have a supplement and an Advantage plan at the same time. You got to make sure that if you go from one to the other, especially if you go from having a supplement to having an Advantage plan, that is your responsibility to contact the carrier that has your supplement and say, hey, I'd like this discontinued. But yes, Medicare supplements, they work with original A and B. They don't replace it. Medicare Advantage plans, Part C. One very big misconception is that it replaces your Medicare. It does not. You can always go back to original Medicare during certain election periods to make that change. So you're never giving up your original Medicare benefits that you've worked for your whole life. Advantage plans cannot offer you anything less than original A and B already offers you. They can only add to. So that is very important to know. And when they do add to it, they help you with those co-insurances, deductibles, all the costs that is your responsibility to pay for. One important word when it comes to Advantage plans is networks. Network is making sure that certain doctors accept the insurance that you take. So it's very important that you keep seeing a certain doctor because that's been your doctor your whole life. They've saved your life. Whatever the reason, it's your prerogative to go with the doctor that you'd like. But you need to make sure that that doctor is in network for the insurance plan that you take. So let's look at some difference. HMOs, PPOs, those are the main ones that you're going to see. The private fee-for-service, Not very common at all. Neither are MSAs. Here are the special needs plans that I mentioned if you have Medicare and Medicaid. And here's the possible fourth option that some people have if they have a Medicare option through an employer that they've retired from. But HMOs and PPOs, high level difference. With HMOs, you have to stay in network. You can't go see a doctor that is out of network. With HMOs, you need referrals to go from your primary doctor to a specialist. With HMOs, there tends to be everything a little bit more inexpensive, and the additional benefits, the vision, dental, hearing, tends to be a little bit better. So with PPO, the flip side is exactly true. With PPOs, there is in and out of network benefits. When you go out of network, the costs go up a little bit. You do not need referrals to go from primary to a specialist. The network's going to be a little bit bigger, costs a little bit more, and then the additional benefits tend to be a little bit smaller when it comes to those vision, dental, hearing. Making sure that people, veterans are aware that there are options if you do not have, if you have VA benefits and you get your prescription drugs from the VA, you can get Advantage plans that do not have a prescription drug coverage. Definitely want to just remind you guys about the maximum out of pocket, whereas original Medicare does not have a maximum out of pocket. That's such an important benefit to be able to have that cap on your financial obligations for your health needs. Extra benefits, vision, dental, hearing, the over-the-counter drugs is a new benefit that's very popular. Transportation, there's a lot of benefits that come with Advantage plans that I'm going to elaborate here in a minute, but having a $0 option that's available to you, all the plans are based on the county in which you live. If you have a $0 Advantage plan option, that may be a better fit for you than having original Medicare and a prescription drug plan. I'll elaborate that in a minute. Medicare, Medicaid. If you think that you may qualify for Medicaid, it does not hurt to call and apply. You can call 1-800-MEDICARE, your Social Security office, call your Department of Children and Family, and apply. The worst it could say is no, and then you're in the same situation that you are now. If you get a yes, a lot of times that Part B premium gets taken care of. A lot of your prescription costs are taken care of. You may just get LIS, a low income subsidy that helps with your prescriptions, but it can't hurt to apply. I encourage it if you think that you may qualify. Enrolling in A and B, let's deep dive into these options a little bit more. If you already have Social Security, you're going to be enrolled automatically. If you do not, you may need to contact Social Security if you want to start your Part B. Guys, communication is key. You cannot hurt to make sure you're very clear with your intent on whether to take it or not take it. The main reason why people don't take B when they turn 65 is that they're still working and they have coverage through work. If you have coverage through work, that is going to be most times credible coverage, and you don't have to worry about a penalty for Part B. The only way you really have to worry about a penalty for Part B is if you elect not to start Part B really just because of the cost. So you don't have coverage, you just don't want to pay that monthly premium. A Part B penalty could start accruing, and we'll get into how that's calculated here in a second. Let's talk about enrollment periods. When it comes to turning 65, you have 3 months before, the month of your turning 65, and 3 months after to make a decision of which direction you want to go, whether it's supplement in a prescription drug plan or an Advantage plan, or just staying on original. If you elect not to start Part B, but you do have the coverage through your employer, you can communicate with your Social Security office when you do want to turn on Part B, and you have much more flexible time. Whereas if you elect to not start Part B just because of the cost, there is a general enrollment period that you need to be aware of. You have from January 1st to March 31st to elect to start Part B, and that is going to start on July 1st. And get with your Social Security Administration to know what that Part B penalty is going to be if that applies to you. Besides that, there are special enrollment periods, such as if you move, if you have just retired and you're just starting your Part B. Another big one that I see is if you have Medicare and Medicaid, you have options throughout the year to make a change. I'm not going to get into the details of Part A premiums, not very common. Here's an example from 2019. If it does apply to you, definitely screenshot it. Part B premiums, that's what most people are going to see once they turn 65 and start taking Part B. And really the only way out of paying your Part B premium is if you do qualify for Medicaid. On the other end of the spectrum, not if you make too little, but if you make more than certain thresholds, you could pay more than your average Part B premium. Here's an example from 2019 when the Part B premium was $135. If you're making more than these thresholds, you can pay an additional premium. And that will be called the Income-Related Monthly Adjusted Amount, or IRMAA. With this page of information, it really lets you know that you can pay this through your Social Security if you're electing to take Social Security, but if you don't, you need to pay out of a bank account. This also is how you calculate the Part B penalty. And just letting you know, if you have coverage through your current employer, as long as it falls under qualifying coverage, you have credible coverage and you don't have to worry about that penalty. To be eligible for a Medicare plan, you need A and B, but to be eligible for a prescription drug plan, you need and or. You need either A and or B. This is a very important subject. There are a lot of people, in my experience, that I've helped throughout the years that are low income, that this makes a big difference. So I want to take a little bit of extra time on this. And it's also going back to the reason why I don't want to charge for this workshop. I want it free to everybody so they have access to the information that helps them make a wise decision. Apply for Medicaid if it applies to you. Call 1-800-MEDICARE, or you can go to your local Department of Children and Families in person and apply. They're going to look for a certain verification of this, verification of your income, verification of expenses, of assets, and they're going to make a determination if you apply, if you qualify at all, but also what level of Medicaid, because there are multiple levels of Medicaid from full to partial. Here's some resources I want you guys to have. Here's a website for ssa.gov. I encourage everybody to get on there and log in. It lets you know a lot about your work history and about qualifying for Medicare. Going into original benefits, just a little bit more, A and B. Here's some of the Part A costs that are your obligation if you do not elect either a supplement to take care of these costs or an advantage plan to help you take care of these costs. Here's, once again, an example from 2019. Part A benefits. This just goes a little bit further into details of how Part A helps you, but the main takeaway from this page is that nothing covers long-term care but long-term care insurance. When it comes to long-term care, they define that as if you have trouble with certain acts of daily living. Acts of daily living include getting out of bed, taking a shower, using the restroom, getting dressed. That is not necessarily a health issue, though, if left neglected long enough could lead to a health issue, but initially that's not a health issue. That is a long-term care issue, and there's long-term care is the only thing that covers that. Part B benefits, going into that a little bit more. There is a Part B deductible, and in 2019 it was $185. At the time of this recording, it's a little bit over $200. Just like anything in life, I think we know everything goes up a little bit as time moves on. I'm not going to go line by line with these benefits, but I'm going to slowly go through these. These are Part B benefits. I encourage everybody to take advantage of their preventative services. That is an original Medicare benefit that even if you just decide to stay with original Medicare and adding a prescription drug plan, that's available to you. And being preventative is key when it comes to your health. Very important, not covered by original Medicare. And you'll notice that a lot of these benefits are the same benefits that are covered with Advantage plans, so that you're not caught by surprise that you are wanting to need help with a hearing aid and you're having a hard time finding a standalone hearing policy. That these are oftentimes benefits that are included in Advantage plans but not included with original Medicare. Original and Part D, just going into this a little bit more, when is this appropriate? I've given you a few reasons why the other two options are better options for you. When is it appropriate? If, one, you have a lot of doctors, there are very, very few doctors that don't take original Medicare. So if you want to look at it as a network, it has a huge network, and you're able to go and travel and go around where any doctor that takes original Medicare is going to take your Medicare. And of course, adding a prescription drug plan to that. And that adding that separate prescription drug plan is going to be, let's just call it $30, though I have seen plans as low as $7. I've seen plans, in the 80s and 90s. It's just important to make sure that you find the right one, you get as detailed as possible, and it's up to you and your responsibility to yourself to revisit every year if you find the need. If you're having new prescriptions added to you, if prescriptions are being dropped off, if your life changes, you should really revisit it and reanalyze your situation and see if there's another plan that's a better fit for you. This is the calculation for the prescription drug plan penalty. It's 1% of the national average for every month that you don't have it, and that will continue to add up until you do finally elect to take a prescription drug plan, and that penalty is going to be charged to you not by the carrier of which you're getting a prescription drug plan from, but from the federal government. So just a quick example, if you have 1% of the national average, call it $30, 1% of that, 30 cents. If you don't have it for 12 months, that's $3.60. So if you wait past 63 days of when you start your A and B, that's when the penalty will start. And at that point in time, if you go a year without your prescription drug coverage, you're going to amass, in this hypothetical scenario, $3.60. When you start it, even if you have the lower premium prescription drug plan, call it $7 and some change, you're going to add that $3.60 to that $7, and that'll go a long way to explaining what's going on there. A couple other things that I want to explain when it comes to prescription drug plans is the tier system. There's 5 tiers. Tier 1 is your most common, everyday, generic, inexpensive prescriptions. Tier 5 is your most rare, exotic, I'm battling some serious illness prescription. And all the prescriptions that are on a particular formulary land on that 1 to 5 tier. A formulary is just a list of prescriptions that particular plan covers. I also want to explain the 4 phases that you go through when you are purchasing your prescriptions throughout the year. First phase is the deductible. We know that that's your responsibility before the plan really starts kicking in. That may be a couple hundred, maybe 400, depends on the plan. Once you get past the deductible is the initial phase. The initial phase looks like it may be $1 for tier 1, $10 for tier 2, I'm just giving you an approximate numbers. It might be $47 for tier 3. Tier 4 may be $95 or maybe a percentage like 47%. And tier 5 is normally always a percentage around 25%. But that is what the initial phase looks like until you and your plan come to a certain amount. Once that certain amount is met, then you go out of the initial phase into the third phase, which is the a coverage gap or donut hole. So that's where the phrase donut hole comes in. And in the donut hole, you are going to pay a percentage of both name brand and generic until both you and only you come to a higher amount of money for the year. And I don't want to get into the specific amounts because I just want you to know how it works, and the numbers itself changes every year. And then finally, once you go out of the donut hole, you go into the last phase, which is called the catastrophic phase, and you pay very low amounts, almost Medicaid type prices until you reach the end of the year and the clock starts over. One more time, when it comes to the supplements and Medigap, sold by private companies, if you turn 65 after January 1st of 2020, Plan F is no longer available, but Plan G still is at the moment. Plan G has always been my favorite out of all of them anyways, because when it comes to the price point, you always made out much better when it comes to Plan G. The only difference between F and G is the Part B deductible. And like I mentioned, in 2019, 185, right now it's a little over 200. And once you get past that deductible, the Plan G acts just like the Plan F anyways. And the difference in premium you get back throughout the year anyways. So it's most cost effective with G, which is still available. About this page, very important, when you first turn on your Part B, you have a guarantee issue period of 6 months, meaning if you have health issues, no health questions are asked. After that guaranteed acceptance period, there are 10 to 15 major health questions. Have you had a heart attack in the last 2 years? Have you been admitted to a hospital in the last 60 days? Different carriers have a little bit different questions. Some care more about heart issues, some care more about diabetes, some care more about other health issues. But if you have to answer yes to any of these questions, there's a really good chance that you're going to be declined. So take advantage of that guarantee issue period. What I found the main reason why people don't go with supplements, whether it's initially when they first turn 65 or ever, is that $200 a month on average nice round premium. Some people can't afford that. And if that's your situation, there's a lot of great advantage plans. Another reason why people may not want a supplement is if they're in great health and they see it as a waste of money for them to pay that $200 a month, because you're going to pay that whether you use it or not. Whereas an advantage plan, it's the flip side of that coin. It's $0 a month, but you pay as you use it. So it's really your responsibility yourself to run these questions through your head and determine what's the best fit for you. These are different charges that your supplement is going to help you cover. And really, when it comes to a supplement, you are buying peace of mind. So that you know, as long as you are able to pay that Part B premium, you're able to pay your prescription drug plan premium, and you're able to pay your supplement premium, you don't have much to worry about. There's not going to be any bills that are going to follow you unexpectedly home to your mailbox. Just going back over the penalties, if you do not have credible coverage, is when you need to worry about your Part B and D penalties. What a supplement or Medigap is not, it is not replacing your Medicare, it is not original Medicare, it is not an Advantage plan. You cannot have a Medigap policy and an Advantage policy at the same time. It's not long-term care, it's not TRICARE, it's not Medicaid. Going back over the changes, January 1st, 2020, if you turn 65 after that. Here is, for you visual learners out there, this is a graph of the different type of plans. Some have been discontinued, but of course you're grandfathered in. Here are some of the benefits on the left-hand side. I just want to point out the only difference in between an F and a G is that Part B deductible, which at the time of this recording, a little over $200, and it definitely makes up for the difference in premium between F and G. Guys, a little bit more information for you. Screenshot this. A wealth of information on these websites. Let's just recap real quick. There is 3 different ways of getting your Medicare if you don't have an option through an employer that you're retiring from. Original Medicare and adding a prescription drug plan to that. In all these options, you're going to have to pay the Part B premium if you don't have Medicaid helping you with that. The second option is adding a supplement to that. And in that case, that covers most, if not all, costs that original Medicare does not, but you're going to pay for that $200 on average. You're still going to pay for that prescription drug plan. Your third option is the Advantage plan. And with the Advantage plan, you have to go even further beyond just making sure you're being thorough with your prescription drug plans. You need to make sure you're being very clear of all doctors that are important to you so you're still able to see. And whoever you're working with needs to understand that. I encourage you working with somebody local, somebody that you can call and speak with the same person. Local representatives, they have more skin in the game. They have more incentive to do a good job by you, that it's not an anonymous phone call. If you are getting that phone call from somebody that you do not recognize, that there's no incentive, there's no accountability once they have placed you with a plan moving forward. If you want a thorough job done, if you want a question answered for your situation, please don't hesitate to reach out. You can see my phone number, you can see my email, you can see my website. Give it a call, reach out. Either myself or a colleague will answer all your questions. Thank you for your time today. Thank you for sitting down with me and listening to Medicare Basics, a virtual workshop.